On December 31st, Chinese authorities notified the World Health Organization of pneumonia cases in Wuhan City with an unknown cause. These mysterious cases would be identified only 1 week later as the novel coronavirus, COVID-19. As the virus grew stronger, it spread from place to place, bringing death with it. Less than 2 months after COVID-19 was identified, it had spread to every continent but Antarctica. Nearly every time the virus would jump from one person to another, it would mutate in some way. It is related to many other coronaviruses, including Middle East Respiratory Syndrome coronavirus, MERS-CoV, bat coronavirus, BAT-CoV, and Severe Acute Respiratory Syndrome coronavirus, SARS-CoV. However, the modern coronavirus diverged from the most recent ancestor nearly a decade ago, so the immediate origins of COVID-19 are not known. Although most mutations had little effect on the virus's properties, a few would create what we know as variants. In order to be considered a variant, mutations in the virus genome have to either increase the transmissibility, increase the severity of symptoms, decrease the effectiveness of public health measures, or some combination of the three. 2020, the first variant of COVID-19, known as the Alpha variant, was identified in the United Kingdom. The Alpha variant is between 30 and 40% more transmissible than the original coronavirus. Identified in South Africa in May 2020, the Beta variant is not only 50% more transmissible, but also has the ability to evade vaccines to an extent. The most well-known of the 4 variants of concern, the Delta variant, was first identified in India in October 2020. The Delta variant is an astonishing 60% more transmissible than the Alpha variant. It is also by far the most infectious of the variants, as infected individuals may have viral loads up to 1,260 times higher than those infected with the original coronavirus. The Gamma variant was first identified in Brazil in November 2020 and is 1.7 to 2.4 times more transmissible than the original coronavirus. So how is it that COVID-19 is actually transmitted? According to the CDC, the virus spreads when an infected individual breathes out small droplets that contain it. Breathing in the air near an infected person, having small droplets containing the virus landing on the eyes, nose, or mouth, and touching the eyes, nose, or mouth with hands that have the virus on them are the 3 most common ways that COVID-19 can travel from one person to another. As the virus spread and evolved, misinformation about both the virus and the vaccine grew rampant. People believed that the vaccine caused more harm than good. However, this is not true. The vaccine is only there to help a person's immune system fight COVID-19. The vaccine is an mRNA vaccine, so it works differently than what people expect. According to the Center for Disease Control, an mRNA vaccine does not contain the live virus. Instead, it creates a decoy virus called a spike protein that prompts the immune system to attack it. This spike protein is found on the surface of the COVID-19 virus. Since the immune system has already attacked the spike protein, it already has antibodies against COVID-19, which helps the immune system react faster to the actual virus, decreasing the likelihood of falling sick and of exhibiting severe signs and symptoms if a person does fall sick. Overall, getting a vaccine is the best way to protect yourself, other people, and bring the pandemic to an end much faster.